Hello, everyone. Thank you so much for joining the webinar today. We're just going to go over some technical difficulties, and we appreciate your patience. My name is Ben Edwards. I'm the clinic manager for the Heart of Wellness. We're located in Tumwater, Washington. Heart of Wellness is a collaborative group practice focused on integrative care that heals for the whole of you. Our clinic is really excited to welcome 2 new physical therapists to our team, which also includes several naturopathic physicians, 2 acupuncturists, massage therapists, and a registered dietitian. They're all dedicated to helping you achieve your optimal health. We also have a dedicated support staff of patient, financial, and clinical care coordinators. Overall, the whole Heart of Wellness team is able to provide care to individuals of all ages and stages on their life and journey of health and wellness. So I'd officially like to welcome you guys to Headaches, Rethinking Your Habits Can Lead to Relief with Jeff Foucrier, Doctor of Physical Therapy. Jeff has been treating as a physical therapist since 2011 after obtaining his Doctor of Physical Therapy degree from Regis University. In 2014, he attained a board-certified specialty in orthopedics, and in 2015, he became an American Institute of Balance certified practitioner. Of pain, weakness, or instability by stretching, strengthening, and retraining body mechanics. Jeff works collaboratively with clinicians to utilize integrative care, helping to restore function, flexibility, and strength. His areas of special interest include craniocervical and spine dysfunction, as well as headaches and their causes. In the chat, you're going to find a link to our website, which includes some of our previous webinars that you're able to view. I also wanted to let you guys know to keep an eye out for our next webinar, which will be with Maya O'Brien, who's attending with us today. And that's going to be scheduled for June 24th. We'll have more information on that to follow. The other thing that we were going to do as part of this webinar is we had a naming contest for our new skeleton, who's part of our physical therapy room. So we put a poll out to all of the staff members and our Facebook followers. After the results of the poll have come in, he will be known as Count Scapula. So we have our newest employee. So if you guys have any questions, feel free to ask them in the chat. At the end, we're going to try and have a brief Q&A session that Jeff will be able to answer some of those on. And without further ado, I'm going to stop talking and I'm going to turn it over to the man of the hour. So here's Jeff Foucrier.
Great. Yeah, okay, great. Hello, everyone. So Ben, thank you so much for the introduction. I really appreciate it. Now, hopefully I can navigate Zoom well, so please bear with me. We're going to go ahead and share my PowerPoint now. Did you do, you have 2 PowerPoint slides up here? This one? Okay, great. All right. I'm hoping everyone can see this. Everyone can see this? All right. Now, again, I'm somewhat familiar with Zoom. If anyone has any questions during the course of this webinar, please don't hesitate to go ahead and write it in the chat section. I'm going to go through the webinar first, and then afterwards, as Ben had mentioned, I'll go ahead and do an FAQ session, or I can ask general questions about headaches. So today, I'm going to give a webinar on headaches. And I kind of had a couple running titles with this. One was a pain to solve, and the other is really rethinking your habits. But they're not mutually exclusive. Headaches can be a challenge to solve, but there can also be a solution to the pain. And a lot of it has to do with rethinking how you move or rethinking your own health. As part of my philosophy as a practitioner, my hope is that you can rediscover your goals, rediscover you and your movement, and recover the things that you would like to get back to as soon as possible. So I'm hoping that you see that theme throughout my webinar today. Moving on. The purpose for today. My hope is that you can, through this webinar, take that first step in finding a long-term solution to the headaches you experience. Now, for a little background about me, you have to understand that I have been in academics as well as a clinician for the past 4 or 5 years. So I was a faculty member at Northern Arizona University, and I still teach courses there. And so I absolutely have to have objectives with anything that I present with. So I do apologize. But by the end of this webinar, I'm hoping that you'll be able to understand that headaches affect many people. For those of you that are impacted by headaches, you're not alone. I'm hoping that you'll also become more familiar with the four most common forms of headaches and how they may impact you in your daily life. Throughout this webinar, I'm also hoping that we find one or two movement factors that may be associated with your headaches. With this, become familiar with the benefits of physical therapy and the treatment of the headaches and potentially these movement factors, which could be a driving reason for your headache. And then finally, considering team-based medicine to find sustainable ways to solve or give you relief with your headaches. As Ben had mentioned, I've been practicing for about 11 years, and during that period of time, I've treated a lot of patients with varying degrees of symptoms as well as diagnoses, many of which have been individuals suffering from pain for a long time, and that includes people with headaches. A common presentation that I will see in a patient that does suffer from headaches include complaints of piercing headaches, neck tension, band-like pressure around the head, traveling symptoms from the head to the neck to the shoulder, or the other way around, from the neck to the head. The onset of these headaches can happen very, very recently, within the past week, even yesterday, to individuals that have been suffering headaches since they were very, very young. In those individuals that have had headaches for a long time, oftentimes there can be other symptoms that you may tell your doctor about that you just don't know if they're connected. Fatigue, dizziness, and lightheadedness are also associated with long-term headaches. And oftentimes when you see your doctor or any clinician, they're going to give you a diagnosis of a headache or head pain. And I mean, just to reiterate this, a headache is when you have pain in the head or the face. And inherently, there's something challenging with this. If you're diagnosed with a headache, what does that really say about your presentation? What does that say about you? What are the far-reaching impacts of your headache? And unfortunately, a diagnosis like headache doesn't necessarily capture all the aspects of the headache that you are encountering in your own life. Now, I'm very curious. As a means to really engage you early on, I want to see what you have tried. And I'm hoping I can go ahead and do a poll here. I did build it in. Let's see. I am not. Do you guys see the poll option here?
I think that there were some technical issues. I don't know if we'll be able to run a poll.
Oh, you don't? Okay, then we'll do that. That's fine. So it looks like the poll section is not working. So what I would like to do instead is to go ahead and chat. What I would like you to do in chat is go ahead and type something in that you have tried in the past for treatment of your headaches. And for those of you who don't know how to use the chat feature, there's going to be a chat icon somewhere around the Zoom border that you'll be able to click and type into. For those of you that don't have direct access to it, you can go to a More. If you go to the border with all the options on it, go to the More drop-down menu and select Chat, which should be something on the top, hopefully the first thing you see. I'm already getting some responses. So I'm going to read some of these off. Topomax, talking about what you eat, changing what you intake into your body, exercising and stretching, hydration, changes to workstation or desk or chair. Great. Medicine has been something that's come up a lot. Sleep, talking about, again, diet, stretching, diet, changing potentially what you use at night as far as a neck pillow. And others have had surgery. Okay. And you can continue to write things in. I may go back to them and bring them up throughout the webinar. Thank you very much for participating in that. So there are lots of different types of treatments out there. And per the research and per my clinical practice, the most common reasons or common ways that someone will be treated is generally medication. And that's followed by changes in exercise, could be massage therapy, acupuncture, and in some cases, surgery to manage headaches. And one thing that I want you to start thinking about is what place should diet, exercise, stress management, and sleep have in your headache treatment and management? And not just one of them alone, all of them. How should they all play a role in managing your headaches? I just want to make sure I get everything here in massage therapy. Yeah, and I think that one of the things too that you're going to find with this is that when we start talking about ways to manage headaches and to find creative ways to treat headaches, you have to do it on an individual level. Having these general applications to management of headache is challenging because each one of our headaches are very different. And we're going to actually speak to that in a little bit. How common are headaches? As I'm sure many of you know, headaches are very common. According to the World Health Organization, headache disorders are the third highest cause of years lost due to disability amongst all different diagnoses, medical diagnoses. That means it affects a large number of people. Additionally, per recent statistics, 46% of the adult population have an active headache. What does that mean? It means that 46% of adults right now are having an active headache. That is a lot of people that are suffering from headaches. This is an old statistic taken from 2003, but in Stewart et al. In an article, or research article, they found that $19.6 billion per year were being used in the United States to manage headaches. And this, again, is almost 20 years ago. Imagine how much money is being spent now. When talking about active headaches, there are many different types of headaches. Of those that are most common, you're going to find migraine and tension type headache. Of those with active headaches, the most common one type of headache is a tension type headache. Now, to build off of this a little bit, there are a lot of types of headaches. According to the International Headache Society classification system, there are hundreds of subcategories of headaches, hundreds. And this is associated not only with what symptoms you have, but also what drives the headache, what causes it. So when you get a simple diagnosis of just headache or head pain, does that really give a good idea to you or to the clinician as far as what is causing your headache? And it really doesn't. Now, to this point, when looking at my clinical experience as well as what the research tells us, there are 4 headaches that most commonly affect people within the United States and across the world. They are migraines, tension type headaches, which we know are the 2 most common types of headaches, cluster headaches, as well as cervicogenic headaches. And cervicogenic headaches are headaches that come from the neck. Typically, patients that have this type of headache state having neck pain and then having head pain. Now, I'm going to let this sink in a little bit, not to overwhelm you. I don't expect you to read this right now. And many of you are thinking, well, I just can't pay attention anymore because there are too many words on this slide. I understand that. The reason this is here is not necessarily to have you memorize all of this and be quizzed on it later, but rather as a resource. Recall that I had said that sometimes you get a diagnosis such as a headache. It doesn't completely cover all of the things that you experience as an individual. Sometimes being able to label or to classify your headache differently or more specifically, it's going to help you understand your headache, as well as the clinician to learn what they need to do. So what I would like you to do with this, again, is not necessarily to sit here and read this, but rather go back to our website, look over this PowerPoint slide and read through this at your own leisure and try to figure out if you do fit into one of these categories. Because again, it might help you in future management. As you probably could have told me at the start of this webinar, in your experience with headaches, and also from the information I presented, headaches aren't simple. They're not. They're very individual in presentation. And with this also, we just don't have head pain. We can also have poor sleeping habits because of the headache, and especially long-term presentation, our sleeping habits can change. We can have mental fog. We can avoid certain activities because we're afraid that we might have a headache. We could have decreased pain tolerance. That means we have more pain and we don't have the right tool set to make us successfully work through our pain on a day-to-day level. We also might develop traveling pains where it's here, but then it's here. To this point, what we have found in the literature and the research, as well as what I've seen clinically, is that the longer you have a headache, there's a greater chance of having other symptoms and the involvement of other systems, including the movement system, which is what I, as a physical therapist, really do emphasize in my own practice. So what is the movement system? The movement system is a collection of different body parts, areas of the body that come together that allow you to move. It's actually quite complex. It includes the endocrine system, for example. It includes the endocrine system, your nerves, your heart, your lungs, and of course, we're all familiar with the bones, joints, tendons, and ligaments. Now, with regards just to those bones, the muscles, the tendons, and ligaments, there are common factors that are tied to headaches. And the most common reasons that a headache may be caused, if it's related to the movement system, are poor head and neck posture, jaw dysfunction, so jaw pain, as well as vertigo. These are the three most common. Now, while being part of the cause, they can also be a solution if we can identify them. Now, if the movement system is involved, and maybe you don't know if it's involved or not, but if it is involved, these are common things you might say to your doctor or to any clinician you're speaking to. I don't move as well. I have decreased motion in my neck, in my jaw, in my upper spine. I may change the way that I move. Maybe because it feels better, maybe because I'm avoiding pain. To that point, you may tell your doctor that you have been experiencing not only just pain, but more pain than usual. And finally, you just don't want to move because you're afraid to do it. You don't want to move because you know it's going to cause a headache. These are common symptoms that could be tied back to an issue with the movement system. Now, what are some ways that headaches can be treated? Now, I would like to add that this is best evidence. This is what the research is telling us right now. The number one best treatment approach with the best outcomes is team-based care and patient education. What team-based care means is that not just one clinician's working for you. You have several clinicians. You have a team working for you with different specialties, and they're coordinating care. With regards to physical therapy, the most commonly referred to techniques that can help with movement system dysfunctions is re-educating movement. That means teaching you, rediscovering movement, your natural movement to help with recovery. Hands-on treatment. Now that I think could include massage therapy, could include adjustments from a chiropractor, could include mobilizations from a physical therapist. It could even include acupuncture. So something where there is manual impact on tissue. Other things you might see is psychological management as a form of adjuvant care, that is as a team-based approach, psychological management, and also pharmaceutical management from a team-based approach. Now, within the literature, as far as in practice, what does movement re-education mean? It means that we're improving body control. These techniques can decrease pain, improve your body awareness, and improve healing and your tolerance to movement and pain. One of the things that one of you, actually several of you mentioned in your chat earlier, was changing the way that you work. We call that ergonomic training, if it relates specifically to your work environment. Now, from what I've seen, most of us, if we, just whether it be socially now with COVID or working in a job, we're always at a computer. We're always sitting like this, our arms are up like this, we're using our upper muscles a lot, okay? And these muscles are directly tied to the movement system around the neck and the upper back and the jaw. But that's not all that changes. What also happens is that we become trained to also breathe from this part of our body up. We no longer use our stomach or diaphragm. So every time we breathe, even when we're not at the computer, we continue to use muscles that are tied directly to the tissue that cause headaches. So within a population, anyone that utilizes this upper part of their body a lot, one of the aspects of physical therapy that I focus on is making sure we can recover breathing patterns, because that's one big way that we can eliminate the movement system from perpetuating or causing other headaches from occurring. Now, hands-on treatment. Again, I know that many of you are familiar with this. The overall goal of any hands-on treatment is to directly treat the parts of the body that are causing issues. It includes massage therapy or acupuncture or chiropractic adjustments or mobilizations. These are all things that can be done through hands-on treatment. The goal of this is to decrease pain, improve the way the tissue moves, decrease spasms, promote normal healing, and increase your pain tolerance. Now I'm going to take a minute just to stop. How is everyone doing so far? Thumbs up is great. Thank you. Even in chat saying K or typing something random in chat, that works too. So let me know that you're still there. If you do have any questions or want me to slow down, please let me know. All right, I do get something in the chat. All right, excellent, excellent. Again, just keep me posted. I should just keep the chat up. All right, moving on. Common hands-on techniques, I've already referred to some of these. Movement is the primary thing we try to do with hands-on techniques. It's to move tissue, it's to move fluid, it's to move blood, it's to move joints. And this generally also is associated with stretching. Now you can stretch a lot of things in the body. You can stretch joints, you can stretch tendons and ligaments and muscles, but you can also stretch nerves. And one of the common nerves involved in headaches, especially for those individuals that suffer from tension type headaches and cervicogenic, so headaches that wrench from the neck, are entrapment or nerves that get stuck on the back of the head. Okay. Some of you may have had injections to these areas, and that's the reason why these areas are treated. They're the what are called occipital nerves. That's part of the skull, the occiput, and also suboccipital nerves. These are very commonly involved in headaches and are directly treated. And as a physical therapist, we can stretch those and actually help reduce irritation in that nerve without having to use any kind of medication. Moving on. So what is a possible treatment approach based on what I have talked about this far? If you go into physical therapy, and in particular, if you see, let's say myself, I really like to have a comprehensive evaluation as well as treatment approach, where I try to engage as much of the movement system as possible. This will occur over a 3 to 4 week period of time. 3 to 4 weeks is important. It takes 3 to 4 weeks for the body to actually respond to care permanently. That is, there is a change. Unfortunately, a one-time treatment or a treatment that lasts 1 to 2 weeks doesn't necessarily cause long-term change in the tissue. It takes 3 to 4 weeks, and that's based on healing times. But as far as what can be included, upper soft tissue stretching, joint stretching, exercises to improve efficiency of movement at the neck, the shoulders, and the jaw and the head, exercises to improve strength, to maintain the range of motion changes, and to further improve efficiency so we don't irritate tissue that's tied to your headaches. And also nerve stretching. I'm going to get in there and I'm going to try to move those nerves because they need to move just as much as any muscle or joint in your body. If your nerves didn't move when you moved, we would have some serious issues. Now, it's not all about the muscles. It's not all about the heart or the lungs. Unfortunately, the longer that someone suffers from a headache or any type of long-term pain condition, it's been found that these individuals are more likely to see a decrease in their mental and emotional health. Depression, anxiety, commonly associated with long-term pain. As far as what the research has shown, and something that I practice myself, there are ways that we can navigate this. There is one type of philosophy called emotional awareness and expression therapy, where through your sessions, you build corrective emotional experiences. That is, we talk and engage pain. We talk about what pain is and how it impacts you so that we can improve your perception and experience with pain. So no longer is pain controlling your life, but instead it's something that you are working through your life with. Now, this is a perfect time also to introduce team-based management. I am a physical therapist. I have a subset of skills that really focuses on movement. I do deal with emotions surrounding movement, but this is a prime example of when I would reach out to my colleagues who specialize in health and emotional management, such as a counselor or a physician trained in this particular type of health management, could also be a psychotherapist. That this is a perfect opportunity for team-based care. But with regards to what you would do in physical therapy, just so you know, EAET here on the top left is emotional awareness and expression therapy. You are encouraged with this to communicate and openly share with people in your life about your pain and how your pain is impacting you. This is very important. You will be given weekly homework. I'm not necessarily going to have you write essays, all right? I may have my students do that, but not you. So for a patient who sees me, I'm going to really engage them on observing their emotions and understanding that what they're experiencing is normal, and they need to accept that. And I usually do this in conjunction, or with, I should say, with journaling, writing down how your day's been going, what you've been feeling, how your pain is, and also the patterns of pain throughout the day. This does a couple things. One, it helps my patients engage their pain. The other thing is it gives me information. If I know what is causing pain, then I can, through treatment, coordinate with other team members or directly treat it myself. Because again, your headache is individual. I need to know what causes your headaches. And this is one means to approach a treatment. Finally, educating the patient on pain science, educating you on what pain is and how it impacts you. And this is actually a topic that I hope to give a webinar here in the near future on. So going back to this idea of team-based management, physical therapists, myself included, have a unique skill set that allows us to treat the movement system for long-term solutions to headaches and even prevent future headaches, but we do not act alone. Team-based care can include lots of different things, medicine, help from a counselor, surgery in some cases. But as far as what physical therapists do, biomechanical, meaning I move your body better so they allow the body to naturally heal itself. And I'm in a very great position here at Heart of Wellness to do that because I have a very diverse set of colleagues that I can pull from for help. Now, I had another poll here, but just to make things interesting for you, we're not going to do a poll. Also technical issues. So what we're going to do this time is I'm going to ask some questions, and I want you to either write yes, no, or I don't know. All right. So the first thing I'm going to ask you on, you can go ahead and go into chat and type this in, is first, do you eat well? Yes, no, or I don't know. I'm glad the dietitian does eat well. That's excellent. Practice what you preach. Excellent. This is really great. And you know, the thing is, it's great even if you say no. It's great even if you say I don't know, because we have to recognize that this is a barrier. This is a barrier to your health. Now, I'm going to explain why I'm talking about this in a second, but I just want to collect this information. So next question, do you sleep well? And that means you generally have undisturbed sleep for about 6 hours a night. Okay. Some of you use some supplements in order to sleep. Okay. Yep. Okay. Okay. I'm just going to let that information kind of settle. Next question I have for you is, do you exercise on a regular basis? Okay. We have some people who say 3 times a week, which is good, semi-regularly. All right. Some people say no. Again, this is all good information. Yep. And one of the things I will say is that movement and pain with movement is one of the biggest reasons people don't move. And so how do we find ways in order to move that doesn't cause pain? Right. And of course, the final question I have is stress management. Do you have well-established ways to manage your stress? Yeah. Yeah. What's interesting is even for the few people who responded so far, stress management seems to be the greatest challenge. And there are many factors associated with this. I do think this past year has put a very significant social stress on everybody. But just in general, it's one of those aspects of our health we have a tendency to forget about. Everyone tells us about eating, everyone tells us about exercise and sleeping, but very infrequently do we have someone sit down and really discuss how do we manage stress. Now, I'm going to get to why we're talking about this. When we look at pain, whether it be headaches or people who suffer pain for a long period of time, there are four factors that have been significantly found, meaning that it's true, as best as we know, it's true that these things affect our ability to recover, to regain our function, and to manage our pain. They are sleeping, eating, stress management, and exercise. Now, this is the thing. If even one of these things is not well controlled, it can perpetuate and increase symptoms of pain. So even from a simple level, something you can do right now is start having that conversation with yourself as far as whether or not, and so this text interaction we just had is that first step. You need to recognize that this is impacting your health and starting to do daily journaling on when you have your symptoms and what may cause them. If you know that your stress management is an issue, journaling what you've done today in order to manage your stress. Now, again, this is a perfect opportunity to speak to other team members, whether it be at Heart of Wellness or somewhere else, hopefully Heart of Wellness, but to really engage that idea that we can manage all these aspects that will drive chronic pain. Now, I know this is not enough information, so I put this slide together for you. Where should you start with each one of these things? I'm all about steps. Your first step, that first phase, don't overwhelm yourself. The reason that we fail, myself included, in order to change my habits is because I expect too much from myself. When someone says, Jeff, you need to exercise more, I'm like, yeah, I do. I need to go out and run 5 miles every day. It's not going to happen because I do it the first day, I hurt myself and I just don't want to do it anymore. Or it's so overwhelming, I can't process what 5 mile means every day. So what has a tendency though to have better outcomes and better at people keeping to a certain plan is to do little increments at a time. So set a consistent sleep schedule. Set regular bedtime rituals. If you love to listen to music before going to bed, do it every night. Okay. If you like to have a little glass of water before going to bed, do that. If you like to meditate before going to bed, do that, but do it consistently and do it well. Eat slowly and drink about 2 liters of water every day. This is a very simple nutritional piece of advice. It's something that I have colleagues here at Heart and Wellness who I'm going to rely on for this because my knowledge is only about this much, that this is something that you can start with. With exercise, that is something I can speak to. Start exercising 5 to 10 minutes of increased activity every day. That means if you, let's say, walk maybe 5-10 minutes, add another 5 minutes to that and sequentially increase that over time. The research has found that even an increase in 5 minutes of exercise a day can have substantial impact on your health. And it's best if you can increase your heart rate. And this is the thing. If you can develop good sleep, eating, and exercise habits, you'll have a much better stress coping capability. So you will be driving stress management in your life. Now, for those of you that are just like, this guy hasn't given me any information that I need, which could be the case, or you just want more, here are some extra resources I find very informative and may, again, feed that part of you that needs more information. This video by Dr. Schubiner is fantastic and talks about the relationship of the brain and pain. Another resource for you is Migraine Again. It's a great resource for individuals that do suffer from migraines, but not only that, any kind of headache. And finally, the National Headache Foundation has some wonderful resources too that I highly suggest you look into. You're very welcome, Tammy. Take care. You're very welcome. Another book that I would recommend is Minding the Body, Mending the Mind, and also The Migraine Brain. 2 fantastic books. So I just want to reiterate, my philosophy as treatment as a provider is that really that you rediscover yourself. You rediscover movement, and the hope is that you can find your pathway to recovery through rediscovery of your movement. I encourage anyone to reach out to us here at Heart of Wellness or call us if you have any further questions regarding the physical therapy service we offer or any other service we offer. And one thing I didn't mention earlier is that note that with this webinar and with the FAQ session, I cannot speak to any individualized care. However, I would be very happy to answer any of your questions now that's generally associated with headache and headache management. So thank you very much. And the floor is open now to anybody that has a question. And I don't think we can unmute. Is that correct? Oh, you can unmute. Oh, fantastic. Okay, do you want me to manage that on my end? I think I might be capable. I think maybe. What you can do is you have a couple options. If you want to ask me a question via chat, feel free to do that. If you would like to go ahead and ask me a question verbally, type something into chat so I can unmute you. Hopefully I'll be able to do that. We'll see. We'll take one thing at a time. And one thing I was just told too is that these resources I shared on my PowerPoint will also make these resources available on our website. Yeah, what a great question. So with regards to dowager hump, basically what we're talking about there is a change in posture in the spine and the surrounding areas around the shoulder and the upper body. The challenge with any kind of prolonged changes in the body posture is that it doesn't just affect that one area. It affects many different areas. So if we're going to work on something like a dowager hump, we would need to emphasize changes in movement from the lower spine, the diaphragm, especially the rib cage, around the shoulders and the neck. One of the restrictions that I have seen that accompany something like a dowager hump would be decrease in motion through the neck and then through the upper spine. Also, I've seen a lot of associated tension throughout the neck and into the jaw as well. These are absolutely reasons or a factor that can drive maybe a cervicogenic headache or a tension headache. So these are that my approach would be whole body for something like that. But it would also be emphasizing education on length of time for change. To change something like this, even minimally, would take, again, about 4 to 6 weeks of consistent care, not necessarily coming in to see me. Oh, no. The biggest part of physical therapy is your participation. If I give something to my patients, I expect them to do it in order to have proper outcomes. So this is consistent investment from the side of the patient. Okay, thank you. We had another post on that. So yeah, our website, we posted at the beginning. Would you mind posting that again, Ollie? Thank you. Yeah, absolutely. And again, on a more individual basis, there would be a much further assessment to look at changes in eating, swallowing, changes in breathing, but also a more in-depth conversation about other factors associated with that, including looking at blood panels from another provider, just to make sure we have long-term success in management of that. Are there any other questions? And again, yeah. So, you know, this is a great point. When you have one type of headache, and I think that, you know, just speaking to Charlotte specifically, the chances you have other types of headache increases. And that's because there are common mechanisms for headaches, oftentimes associated with stress and changes in the heart or lung health, as well as what happens within the brain itself, anatomically, physiologically. So it is not uncommon to have one type of headache or migraine and then over time develop something else. A very common presentation I see are tension type headaches and what you mentioned, migraines. Now, vestibular migraines are a little different. This is one of those subcategories, right? And so that is something that you would need to really spend some extra time in identifying factors tied to that and work with your provider. Yeah, absolutely. And then going back to what I mentioned before, the vestibular system, so our balance system, highly tied to the frequency of and intensity of headaches. And I have training in treating the vestibular system. So I'm not in charge of anything, mind you. Okay, nothing. So how are we doing with time? Do you want to continue going or? We're over time. Okay. Well, I do. Okay, yes, I do have a patient coming. So I want to make sure that I'm there for my patient. Thank you so much for joining me today. I do like to, I would like to continue giving these webinars, and I'm sure some of my colleagues will as well. So I look forward to interacting with all of you in the future. Thank you so much, and I hope you all stay healthy. You got it. Absolutely. Happy to be here. Bye, everyone.